Dear students, welcome back. In this session, we are going to discuss about deep muscles of back of the leg. The deep muscles are Flexor Hallucis longus, Flexor digitorum longus, Tibialis posterior, and also popliteus, which is also included in the deep muscles of the back of the leg. So this popliteus we have already discussed. So now we will discuss about one by one. The first muscle is the flexor hallucis longus. If you see the origin of this flexor hallucis longus, which is originating from the middle 1/3 of the lateral half of the posterior surface of the fibula. So here, okay, from the posterior surface of the fibula, that to middle 1/3 of the lateral half of the posterior surface of the fibula. Okay, and also lowest part of the interosseous membrane, also some of the fibers are originating. Okay, now we will see the insertion. So this flexor hallucis longus, if you see the insertion, the tendon passes under the flexor retinaculum. Here the tendon passes the flexor retinaculum on the medial side of the leg. Okay, so to enter the second layer of sole of foot. Okay, so this one, here you can see the insertion very clearly in this. Yes, so this is the sole of the foot, so it enters into the second layer. As we know that there are 4 layers in the sole, so in the second layer the tendon will enter, and then finally it is inserted into the plantar aspect of the base of the terminal phalanx of the great toe. This is the insertion of flexor hallucis longus. Now we will move on to the another muscle, that is flexor digitorum longus. So in this pic you can find the flexor digitorum longus. So this one is originating from the medial half of the posterior surface of the shaft of the tibia below soleal line. That means here we can find the soleal line in this pic. So below this soleal line, medial half of the posterior surface of the shaft of the tibia, So this is the origin of flexor digitorum longus. The tendon passes under the flexor retinaculum. This one also, here you can find the tendon very clearly. So this tendon passes to the flexor retinaculum, and then it enter into the second layer of the sole of foot. So this one also enter into the second layer of the sole of the foot. Now we will see the insertion how. So once it enter into the sole of the foot, okay, actually this here we can have the flexor retinaculum. Okay, under the flexor retinaculum this tendon comes and then enter into the second layer of the sole of the foot, where it splits into 4 tendons. Okay, for the lateral 4 toes, okay, and all are going to insert into the base of the plantar aspects of the corresponding phalanges. Okay, so this is the insertion of the tendon. This is the insertion of the flexor digitorum longus. And These two muscles are supplied by the posterior tibial nerve. What is that? Posterior tibial nerve. And if you see the action of flexor hallucis longus, the flexor hallucis longus flexes the great toe, okay, and whereas if you see the action of flexor digitorum longus, which flexes the interphalangeal and metatarsophalangeal joints of the lateral four toes. Okay, now we will move on to the next muscle, that is tibialis posterior muscle. The tibialis posterior muscle is originating from the lateral half of the posterior surface of the tibia below the soleal line, okay, and medial half of the posterior surface of the fibula, and then posterior surface of the interosseous membrane, okay. So this is the origin, and if you see the insertion, the tendon passes under the flexor retinaculum. So this one enter into the fourth layer of the sole of the foot. And it divides into a medial and lateral part. And this one is divided into medial and a lateral part. Okay, the medial part inserts into the tuberosity of the navicular bone. And next one, the lateral part divides into slips which insert into all tarsals excepting the talus. So each slip is going to give branches to all the tarsals, okay, all the tarsal bones except talus, okay. So this is the insertion of tibialis posterior, and this one also supplied by the posterior tibial nerve. If you see the function, it is the powerful inverter of foot, which helps to maintain the medial longitudinal arch of the foot, helps in plantar flexion of the foot. So what are the actions? Powerful inverter, okay, and plantar flexor, and it maintains the medial longitudinal arch of the foot. So these are all the actions and origin, insertion, nerve supply and actions of the deep muscles which are present in the posterior compartment of the leg. Thank you.